Hello, everyone. Welcome. My name is Dr. Anna Pace. I am the assistant professor in the Department of Neurology and the director of the Transgender Headache Medicine Program at Mount Sinai in New York. I'm very excited to be here, being hosted by the American Migraine Foundation to talk about a very important topic that's near and dear to my heart, about migraine and the transgender community. So thank you all very much for joining us. We're going to be starting with a brief overview of some key points and some questions that I often get asked about migraine and transgender patients. And then afterwards, we're going to open up for some live questions, which you're more than welcome to type in the question session in the corner or the chat section. And we also have some questions that the American Migraine Foundation gathered from social media prior to the broadcast. Hopefully you guys can see my screen. Okay, so how common is migraine in the transgender community? In general, there is an estimated about 1.4 million transgender adults living in the United States right now. However, the exact data for how common migraine is in transgender individuals is lacking. Unfortunately, we only have two small studies that are available. One is from the 1990s and the other is from the early 2000s. So it's been quite a while since there have been studies looking at this. In those studies, there are 17 to 26% of transgender individuals reported having migraine. Now, given that there are over 39 million Americans who have migraine, this is likely a gross underestimate of how common migraine is in the transgender community. So what are the causes of migraine in transgender individuals? We think that the cause of migraine is the same, regardless of race, ethnicity, or sexual orientation. We think that migraine comes from having a hyperexcitable brain. So what does that mean? We think that in people who have migraine, neurons in the brain are activated, often when they're not supposed to be activated, but they are. And after that, it leads to a release of chemicals in your brain that result in inflammation and the experience of pain. And we know that triggers may increase the likelihood of attacks. So things like lack of sleep, dehydration, missing a meal, stress, the weather. But in general, the initial part of migraine is having this hyperexcitable brain. So how do hormones relate to migraine? And this is something I think that is one of the more interesting parts about migraine in general. We know that hormones can affect migraine in cisgender women based on some of the studies that we have for postmenopausal women who are on hormone replacement therapy or people who have been on oral contraceptive pills. Migraine in general is more common in cisgender women compared to cisgender men, and we do think that this is related to hormones and hormonal fluctuations. There are a lot of women who have fluctuations in estrogen during their menstrual cycle, which then can trigger migraines. So a lot of patients will say they get worsening headaches around the time of ovulation or around the time of menstrual bleeding. And so this fluctuation in estrogen, where there is a peak followed by a drop in estrogen, can be a trigger for migraines. We also know that estrogen can promote aura. So for some women who are on estrogen postmenopausally as hormone therapy, there have been studies that have shown that the estrogen can either make them more likely to have aura, increase the frequency of aura, lead them to having new onset aura. Now, this is in cisgender women. We don't really have a lot of data, unfortunately, in transgender individuals who are on estrogen, but based on this information, we can kind of imply or infer that perhaps estrogen may play a role in the development of aura. There was also a study that found that in cisgender men with migraine, their estrogen levels were perhaps slightly elevated and their testosterone levels maybe slightly decreased. So based on the data that we have in the cisgender population, it seems that estrogen and testosterone may play a role in the development of migraine or the frequency of migraine attacks that patients will experience. So how does this relate to hormones in transgender people? As I mentioned, unfortunately, there is no specific research looking at how hormone therapy affects migraine in transgender individuals. We do have some biochemical studies that suggest that the processing of pain is affected by estrogen and testosterone. So in people who are on estrogen, they may find that their migraines may increase in frequency. And in patients who are on testosterone, they may find that their migraines may be a little bit better. However, interestingly, it seems that when hormone therapy is consistent, migraine frequency actually can be better. And again, this kind of goes back to the information that we have about menstrual migraine, or women who have headaches around their menstrual cycle. It's the change in hormone level that seems to be a big trigger for people, not so much the level. So when people who are on hormone therapy are on a stable level over time, they may actually find that their migraines are stable or reduced in frequency. So what exactly are the goals of migraine treatment, primarily for transgender people, but also cisgender people? The goal of migraine is the same, regardless of gender or sexual orientation. We always want to think about a reduction in headache frequency and severity. We want to minimize and avoid triggers. And we also want to improve quality of life and functionality. So no matter what race, ethnicity, sexual orientation you are, those are still the goals of migraine treatment. In general, treatment plans should be individualized. You want to be able to use medication and non-medication options. And regardless of whether the patient is cisgender or transgender, providers must always consider any other medical conditions that a patient may have before starting treatment. So the patient has high blood pressure, they have diabetes, sleep apnea, asthma, stroke, all of that information is really important before determining course of action in terms of starting a treatment for migraines. It's also very important to address any mental health needs. So if a patient has a history of anxiety or depression, they have a lot of stress on their plate, those things are really important to think about and keep in mind when starting a treatment. We know that stress is a big trigger for migraines, and we know that people with migraines, whether cisgender or transgender, may also have a higher likelihood of having anxiety or depression. So treatment of those things can also help improve their migraine frequency and vice versa. Some specific considerations for transgender individuals. There are some migraine medications that may interact with hormone therapy, so it's really important to discuss any change in medication or hormone therapy with your doctor. Some examples of medications that may interfere with the metabolism of hormone therapy include topiramate, which is a very common migraine prevention therapy, zonisamide, which is another common migraine therapy, as well as valproic acid, which is another one. So it's really important because those medications may affect the level of testosterone or estrogen that one has in the body if you're taking hormone therapy. So we need to follow the levels very carefully, and we need to make sure that there's no interaction so that people can still maintain their hormone therapy. One thing I really want to stress is that transgender people with migraine do not have to choose between continuing hormone therapy and managing their migraines. That therapy should happen concurrently, and treatment for migraine should help support the continuation of hormone therapy. So transgender individuals may find when they start hormone therapy that their migraine frequency may change, maybe for the better, maybe for the worse, maybe it doesn't change at all. But the whole point of the migraine management is to really help support that patient and allow them to keep on their hormone therapy and manage their headaches. Before I get into that, I know some people are probably trickling in, so I just want to reintroduce myself for anyone who just joined. My name is Dr. Anna Pace. I'm an assistant professor of neurology at Mount Sinai in New York City, and I am the director of the Transgender Headache Medicine Program there. We've been talking a little bit so far about some general information about migraine in transgender people, and now we're going to get into a little bit more about how to advocate for transgender individuals and how to overcome barriers to access to care. So one of the common questions I often get asked is, how can transgender people living with migraine advocate for themselves with their provider or their community? I think finding a healthcare provider who is LGBTQ friendly is really important because you want to feel comfortable with the physician. It may mean that you need to see a few physicians at first before you find the right fit. I think the way I describe this is a similar way I describe to my patients about finding a therapist or just finding a doctor in general. Sometimes you have to try a couple of different physicians, meet them, talk to them before you feel comfortable, you can trust your physician, or really find the right fit. So sometimes it takes a little bit of time, unfortunately, to get to that point. However, having that relationship is really crucial because honest and open communication really helps make the therapeutic relationship and treatment work better. Don't be afraid to ask questions. Educating yourself about migraine and how to manage your migraines going forward is really the best way for you to arm yourself with information and really help you make educated decisions about what treatments will work for you and what won't work for you. I think also considering identifying a support ally you may want to bring with you to appointments is really also a good idea, especially if someone who you feel comfortable with and who will be able to also advocate for you during the appointment, as well as how you are advocating for yourself. And I think the last part about this is also asking your healthcare providers to coordinate care across all disciplines. So you may be seeing a primary care doctor, an endocrinologist, a headache medicine specialist, and it's really important for all of your doctors to be working together and be on the same page in terms of your treatment, because you don't want one thing to affect the other thing negatively. You want everyone to feel comfortable with the regimen, including you, and work as a team. That's really important. So are there barriers that the community faces when accessing care for their headaches? I think in general, stigma is probably the biggest one. Now, we know that people with migraine already has a stigma. It's an invisible illness. People who've never experienced migraine before may not understand what it feels like, and they may just dismiss it as just a headache. And being transgender, also, there is a societal stigma to that. I think the important thing about this is the experience of migraine is the same, regardless of whether you identify as cisgender or transgender. I think transgender patients with migraine have the stigma of migraine and the societal stigma of being transgender, and this may affect their likelihood of seeking out care. I think transgender people also feel like that perhaps they are less likely to seek care or fearful of going to seek care because of possible past discrimination, not feeling comfortable with providers in the past, or even having insufficient insurance coverage. I think also it's very important to acknowledge that there are healthcare providers who may have a gap in knowledge in terms of the care that is needed for transgender individuals. Many patients may feel like when they go to see a doctor, they often have to essentially teach a physician about their transgender needs or over-explain themselves during visits, and that may be a reason why they may be less likely to seek care. So how can we address these barriers? First and foremost, I think we as headache medicine specialists really must affirm and acknowledge the authenticity of transgender and gender non-binary individuals' identities. Respect for patients is important, and so we really need to create a welcoming environment for transgender individuals to feel comfortable coming to the office and being able to explain their concerns and their symptoms and feel comfortable asking questions. I think the biggest part about addressing barriers would be education. Unfortunately, transgender medicine is not always taught consistently in medical school curricula. So we really need to work on improving training for that, as well as in residency and fellowship, to teach more physicians about the unique needs of transgender individuals and the unique needs of transgender individuals with migraine. It's also very important to promote transgender-related research and funding to really assess the needs of this population, as well as address the needs that are not being met currently. There is a significant lack of research currently for migraine in transgender individuals. I think the more that we know, the better we can treat patients. That's kind of true, not just for transgender individuals, but also for cisgender as well. The other thing I think that's really important is assessing any bias in the structure of clinic or electronic medical records. Many transgender individuals have difficulty when they go to the doctor's office in terms of using the bathroom, using preferred pronouns. Unfortunately, there are some clinics who don't know about the proper terminology. So those things are really important to work on to really create this welcoming environment for these patients and create an inclusive, culturally sensitive working environment and patient care. At the same time, I think it's really important for all of us to advocate for increased access to healthcare and better access to resources. And this sometimes can be done on a state level, can be done on a national level, in terms of really trying to work on policies that can be helpful to improve access to care for transgender individuals. I wanted to come up with a list of some general resources that may be useful. I think probably finding an LGBTQ friendly healthcare provider is probably the #1 resource that I think will probably be useful. There's also a resource here at the bottom. The American Migraine Foundation has a Find a Doctor website where you can also find a headache medicine specialist specifically to help you take care of your migraines. There are so many out there, but again, still sometimes not enough. And that essentially is all of the slides that I have. So I am going to unshare my screen here and open up for questions. Hopefully you guys can still see me okay. If you have any questions, you can type them in the question box. Otherwise, I also have some where the American Migraine Foundation was able to elicit them from social media, so I can bring some of those up. So they were actually very, very good questions. Okay, so I'll let you guys type in as you feel comfortable, but we can go through some of these questions here. So one of the first questions, why is there not more research being done on migraine in transgender people? It's a really good question. I wish there was more research. In general, I think part of the limitation is that transgender individuals may not feel comfortable seeking medical care. They may not feel like they have the ability to participate in research. I think funding is also lacking. People may not have access to a healthcare provider or may not have access to a headache medicine specialist based on where they live or their insurance carrier, those kinds of things. We are working on really trying to expand research for migraine, specifically in the transgender population, but it's been a work in progress and we definitely have a lot of work to do. The next question is, can testosterone cause migraine? It's a really good question also. So in general, testosterone is a hormone that tends to be very anti-pain. So there have been some studies both in animals and in humans, primarily cisgender patients, where testosterone has been used to help reduce the experience of pain. There are very few studies, there are not a lot, and there aren't really specific studies in the transgender population. Overarchingly, I would say if there's any manipulation in hormones, whether increase or decrease, any change could potentially affect migraines. So it's hard to say for certain that testosterone is the primary reason for causing migraine, but any change in levels could potentially affect migraine if it's also affecting estrogen as well. It's a hard question to answer based on the information that we have so far. The next question here, what is it like living with stigma from migraine and the stigma of being transgender? I wish I knew how to answer that question, but I myself suffer from migraines and I know firsthand how difficult it is to explain to someone that migraine is not just a headache. I can't imagine how difficult it must be for someone who has migraine, who is also transgender, to find a provider who is comfortable managing their migraines and any transgender needs that they have, and also trying to explain themselves to family, friends, and whatnot. I think that's really part of the reason why we strive to take care of transgender individuals with migraine, because migraine is very stigmatized, and it's very hard to live with, especially when attacks are frequent. I'm sure there are a lot of societal pressures for people who are transgender, that they have to deal with stressors every single day, which may worsen their migraines. They may have a history of anxiety or depression, or they've had trauma in the past. That's true for transgender patients, but also for cisgender as well. There are a lot of layers to having migraine, and I think having migraine really does all unite us in terms of working together to find treatments and to really advocate for ourselves, as well as advocate for better research, better treatment, and more visibility. And I think that's really important. Okay, the next question I have here is, how does menstruation affect the frequency, severity of migraine in male to female or female to male trans people? Okay, this is a hard question. We don't, again, you guys will be sick of hearing me say this, but we unfortunately don't have specific data for this. However, depending upon what is going on with the hormones, your headaches may increase or decrease in frequency. So for people who are male to female or on estrogen therapy, they may find that the estrogen may increase their likelihood of more frequent headaches if they haven't already had them in the first place. For people who are female to male on testosterone, they may find that their headaches get a little bit better. Menstruation then gets a little bit complicated because some people may also undergo surgery, which may affect whether or not they're actually having menses. If they're not having surgery, it really depends on the level of hormones that they're on at that time and what the measurement of their hormones are in general really determines whether or not their migraines are going to be more severe, more frequent, or not. I think the important thing to note is that every person is different and every person responds to hormone therapy differently. And so we really need to take it on a case-by-case basis and essentially see as hormone therapy progresses and see how the menstrual cycle continues, where the headache frequency is, and then manage from there. As a piggyback to that question, someone also asked, how do transition surgeries affect migraine frequency and severity? What we know from cisgender patients, in general, hysterectomies and oophorectomies sometimes can increase the frequency of migraines. And that's primarily because, as we alluded to a little bit before, if the estrogen levels are high and then they quickly drop because ovaries are removed, that very quick drop in hormones can be a trigger. We don't have that same data in transgender individuals. Clinically, we see that people respond differently after transition surgeries. So depending upon what type of surgery that you have, what I often recommend is keeping a headache diary prior to surgery as well as after surgery. And we can determine what the frequency is before and after. It also depends on whether or not hormone therapy is continued, what level the hormones are at. That really does also affect your frequency of migraines. Again, the surgeries themselves are not something that one should be concerned about in terms of causing migraines or leading to migraines. The idea is that migraine therapy should help support any intervention that a transgender individual would want to have or to continue hormone therapy. And so again, more of a case-by-case decision and conversation that a person would have with their doctor. Okay. Next question is, how much does trauma play into migraine frequency and severity? I would assume what this question means by trauma is specifically psychosocial trauma or perhaps sexual trauma. Could also be physical trauma. It wasn't explicitly mentioned. However, regardless of whether you are cisgender or transgender, any history of trauma could increase your likelihood of having more frequent headaches or more severe headaches. We know that some patients with post-traumatic stress disorder are at a higher likelihood of having migraine headaches and vice versa. So again, as we were talking about a little bit earlier, I think it's really important for a patient to essentially discuss with their doctor about any psychosocial stressors that they may have, any history of anxiety or depression, or history of trauma in the past, because mood and migraine are very closely related to each other. When your mood is down, you're feeling anxious or more stressed or more depressed, your migraines can get worse. When your migraines get worse, you can have more anxiety, more stress, feeling more down. So it's important to treat both. And that's regardless of whether you are cisgender or transgender. I will say that based on the information that we have, transgender individuals do seem to report a higher likelihood of, anxiety and depression. And so treating those things are really an important part of migraine management for those individuals. But again, also for cisgender patients as well. Okay. Let's keep looking at some questions here. How do you deal with the gendered stigma of migraine being a quote unquote woman's disease? That's a very interesting question. I've actually never had anyone say that it's a woman's disease, but I understand why someone would say that. So we do know that cisgender women are more likely to have migraine than men. That doesn't mean that men cannot have migraine. And I can tell you clinically, I have very many men who do have migraine. Often runs in the family. I think, again, stigma is a really big problem for people with migraine and also people who are transgender. So really advocating for yourself and educating, I think, are the two big parts of overcoming stigma. If you have someone who says, oh, that's a woman's disease, or it's just a headache, as difficult it may be and as tiring it may be to do it over and over again, educating those people is really important, and talking to them about what you experience and how debilitating migraine pain can be, and advocating for more visibility about the disease and for more research, I think really will start to open people's eyes to how difficult migraine can be. So those two things, I think, would be the best way to help face stigma. Now, if anybody has any other suggestions, I'm definitely open to those as well. But it's definitely a work in progress and something that we all are really striving to achieve, because migraine is so incredibly common and people suffer silently very often. Okay. I think those are all of the questions that we have. Does anybody else have any other questions that they want to type in? I will give you a few minutes to do that. I will say in general, I think migraine is something that unites all of us. So if you are listening in and you have migraine, regardless of whether you're cisgender or transgender, I think whenever you find someone who also experiences migraine, there is a little bit of a connection there. I think you may find someone who actually understands what it feels like to have migraine. You know, as part of the American Migraine Foundation, it's really important to band together with other people who understand what you're going through and experience what you experience, maybe perhaps a little bit differently, but at least they would understand. And by doing that, really we can fight against migraine together and really move to improve funding and research for this really debilitating disease. I think especially for those patients who are vulnerable. I think we actually have a couple of questions coming up. I'm not sure why I can't see them though. Hold on one second. Bear with me. I'm not the best at technology, so let's see if I can find it. I can't see them. I'm getting a notification that there are some questions in there, but I cannot see them. Let's see. Okay. It looks like the American Migraine Foundation is going to help me out here. I apologize, guys. They're going to type them in here. Oh, cisgender explanation, please. Oh, that's a good one. Okay. So the term cisgender is used for a person who has a specific sex at birth and identifies as that going forward. So if a person is born as a woman, they identify as a woman, as female. For transgender, they may be born as a male, but identify as female, or they may identify as non-binary, which then leads to the next question. So non-binary essentially is a term that's used where we use the term binary to mean two, male or female. So non-binary means that they are a bit more gender fluid. They don't necessarily identify as solely male or solely female. Oh, these are all great questions. Can you please comment on stroke risk in transgender people taking estrogen who have migraine with aura? That's a really great question. So we know that there are certain formulations of estrogen that will increase your risk of stroke. And that is specifically in transgender individuals. So there are very high levels, pardon me, let me rephrase that. There are certain formulations of estrogen that have a higher likelihood of creating blood clots. In general, those are really not used so much anymore. Other preparations that are lower levels of estrogen seem to be working just fine and have a lower likelihood of clot. In cisgender women, we know that aura can be worsened by estrogen. And based on some of the information that we have, again, from postmenopausal women and a lot of data that is, for lack of a better term, a little bit dated, that women with aura are at a slightly higher increased risk of stroke compared to the general population. Now, this is for cisgender women. We don't have specific data on transgender women or transgender men in terms of stroke risk on estrogen. What I would say is that in general, I try to recommend people reduce aura as much as possible. That may be with preventive therapy, lifestyle modifications, things like magnesium, for example, and try to reduce anything else that could potentially increase stroke risk. So avoiding smoking, avoiding cocaine use, eating healthy, staying well hydrated, trying to reduce any risk of high cholesterol, high blood pressure, or diabetes, as those things all can increase your risk of stroke on its own. Okay, another question. How do changes in estrogen and testosterone interact with prolactin to cause migraines? Knowing that high prolactin is correlated with migraines. That's a good question also. Oh, okay, let me try to explain this as best as I can. Fluctuations in estrogen and testosterone can affect the pituitary gland, which is a gland that essentially is kind of the powerhouse of controlling hormones in the body. So whenever you're manipulating hormones, it can affect the production of other hormones that regulate those. While I'll be honest, I don't know a lot of specific data on high prolactin correlating with migraines. We know that any manipulation of hormones, estrogen or testosterone, can affect migraines because of the change. The best way I could describe this is that the migraine brain likes routine. It does not like when it gets disrupted in any way. So if there's a change in routine, it could be sleep, hydration, missing a meal, the brain almost doesn't know what to do with itself, and it will just kind of essentially go into the migraine pathway. And the same essentially goes for hormones. So when the brain gets used to a certain level of testosterone or estrogen in the body, and then there's a change in that, that could potentially trigger a migraine. So any manipulation, especially if it's going up and down fairly frequently, can increase the likelihood of having headaches. There's a second question kind of related to that. Does progesterone itself relate to migraine one way or the other? We actually don't have a lot of data for progesterone really having an effect on migraine. There was one study that was done quite a number of years ago that looked at the role of progesterone in helping to potentially reduce migraines that were experienced around the menstrual cycle for women. What they found was that progesterone really doesn't affect whether or not you get the migraine. It can just essentially make the migraine happen a little later after menses. So progesterone is not really something that has been shown to be consistently something that affects migraine frequency. Oh, I love this question. How do we as headache physicians make ourselves available or visible to members of trans and LGBTQ community? Oh, I think all of us really need to work together, perhaps come up with a database, or really just be very proactive about advocating for transgender individuals and the LGBTQ community, and find a way to make them more visible and make ourselves more visible as well. I wish I had a good specific answer for this, but I think even having a webinar like this really is just helping to educate people, and I'm hopeful that other headache medicine providers will take the initiative to learn a little bit more about how to manage headaches in the transgender population. I think the lack of education in medical school is something that is a big limitation. Working on improving education is a really great way to help ourselves be more helpful and more visible to the trans community and the LGBTQ community. I'm going to think about that question a little bit more too, because that's a really good one. Any data or guidance on CGRP meds and hormones? Nope, unfortunately, no. But I would say that based on the information that we have, unless there is a history of stroke or heart attack or anything else concerning CGRP medications, may be a useful treatment option for people who are transgender who have migraine. But again, that's a question that I think that's really important to be discussed with your doctor. So if you have a headache medicine doctor or a neurologist that you see, and you're interested in something like a CGRP monoclonal antibody, and you are transgender, I would recommend having that conversation with your physician to really talk about the risks and benefits, the pros and cons, based also on what other medications and medical history that you have. Okay. Has there been research specifically into migraine in intersex individuals? That's another good question. Unfortunately, no. I think we really are lacking in terms of the amount of research that we have to really understand what happens when a migraine occurs in someone who is transgender, gender non-binary, or intersex. I suspect a lot of the same processes are ongoing, but again, because we don't have specific data and we don't really understand specifically how hormones can affect migraines in these patients, it's really hard to say for sure. We are working on it, and I think as I mentioned, we do have a long way to go, but we are making strides in helping to really find out that information. Okay, not a question, but a comment. In our local region, there is a local pride group that has created a reference list of LGBTQ affirming providers. Yes, so in the slide set, which hopefully I will be able to at least put some resources up for you, there are quite a number of websites who have a list of LGBTQ friendly providers. glma.org is one of them, as well as the, oh gosh, I'm losing my train of thought here. A second, I can tell you. There are actually quite a number of websites that have resources. the World Professional Association for Transgender Health, that's the other one. Both of those have directories where you can actually look based on your location and the type of physician that you're looking for, find a provider who is LGBTQ friendly. What I will say is they're not headache medicine specific, but they can be very helpful to find a primary care doctor, an endocrinologist, any other kinds of specialists who have who are gender affirming and LGBTQ friendly. So I definitely encourage you to look up those resources. Okay, so I think we are out of time, but I want to thank all of you for joining us this evening. I hope that this was informative and interesting and helpful. And I also think that as far as I understand correctly, the American Migraine Foundation has recorded this. So if you wanted to look at it later, they will be posting it as well. And if you have any other questions, you're more than welcome to type them into the chat. But thank you again for joining me this evening, and I hope you have a great rest of the night. Bye.